Now let's dive deep into this big LGBTQ story for today. I'm Cindy Brown, and let's queer up the USA view. A Massachusetts study shows growing strain on LGBTQ even in the bluest of states. A new report from the Fenway Institute and the Equality Fund at the Boston Foundation paints a complex picture of LGBTQ life in Massachusetts, often seen as the most progressive and bluest state in the nation. Despite the state's reputation, the report finds persistent disparities between queer residents and their straight cisgender peers in health, housing, and economic stability. Entitled LGBTQ+ People in Massachusetts, Strengths, Challenges, and Opportunities in a Diverse Community, the report shows that 9.1% of adults now identify as queer, a significant increase since 2016. But while the community is growing and geographically widespread, too many still face barriers to quality healthcare, financial security, and safe, welcoming spaces, especially those living outside the greater Boston area and people who are Black, Indigenous, or people of color. The report notes that LGBTQ adults are 1.6 times more likely to report poor health and 3.8 times more likely to have seriously considered suicide. Food insecurity also hits the community hard. 56% of queer households in the state report struggling to access food. Still, the report offers a roadmap for change, calling for better mental health services, more inclusive housing, and safe school environments. As Sean Cahill of Fenway Institute put it, quote, "We must maintain Massachusetts as a beacon of hope," end quote. And that means action, because even in the bluest of states, queer equality isn't guaranteed. Queer News Tonight notes that if these are the statistics in Massachusetts, what would the results be in deep red states in the South and in Florida? That's a very good question. It's hard for everyone now, and if we feel that if they're feeling the struggle in one of the most progressive states in the country, I know that the fact that they did the survey in and of itself is great news. Miami-Dade County did a similar study, and I sit on the LGBTQ advisory board for Miami-Dade County, and we took that survey and we are now creating our own roadmap to try and address these disparities. So, this is really important news, and the fact that they're using the results of the study to make changes and create a roadmap for moving forward that could be duplicated in cities and states across the country.
Yeah, I think that's one of the unique things we have to keep in mind in these days going forward, not just on this topic, but similar ones. Florida has been experiencing the dregs of all of this for 4 years now.
Mm-hmm.
Right.
We've learned lessons of survival that we'll now be able to teach to our friends in the blue states. I interact through AIDS Healthcare Foundation. I interact with a lot of folk who are in DC and New York and LA, and they're really having a hard time wrapping their heads around the current administration. How can things just sort of happen? But aren't there rules? Aren't there guidelines? And they're still grasping that, everything is off the table now. The things that you thought were the norms are gone simply because the leader spoke that they'd be gone.
Right.
And we are uniquely positioned in Florida now to tell our friends, there will be pathways forward. You just have to navigate it a little bit more.
Right.
Yeah. Yeah. I mean, Massachusetts, if I'm correct, is one of the states that actually completely adopted like a universal health care. And so it's where a lot of the red states, of course, rejected tenets of Obamacare and didn't subscribe to the Medicaid protections that are available through Obamacare, the Affordable Care Act, excuse me. And so it's shocking to see that in that state, people are facing, the inability to access quality healthcare. So I can only imagine what's happening in the red. We don't have to imagine.
Yeah, they can't get any health
They
care
can't
at
get any
all.
health care at all because so these people have access to health care if they've signed up for, the state program, as I know that exists. However, they still can't get it. So imagine if you're in a state that doesn't even have access to it, and let alone, let's not even talk about mental health access in
so
general.
important.
Yeah.
Well, that's why nonprofit organizations like, say, schools like JCS and Lambda Living, Sunser, all of them are so important to the community because we know how to address mental health challenges in the LGBT community for people of all ages. And it doesn't matter if you have money or not. We have organizations that can definitely help.
And, the diversity of population living outside of Boston. I mean, Massachusetts is probably the size of, or maybe smaller than Miami-Dade County.
Right.
So just imagine, no one's really that far from Boston and Massachusetts.
Right.
But, if you're in Homestead here and you're trying to get to healthcare in Miami Beach, that's a challenge.
Yeah.
So let's not even, talk about if you lived in the center of the state of Florida, where you would go for healthcare or access to any of those services. So if they're struggling in Massachusetts, it's only going to be that much worse in a lot of these other red states.
Keep fighting.
Keep fighting.
We got to keep fighting.
And vote. That is a big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.